Welcome back to another episode of the Benefits Insider. I'm your host, Chris Hamilton, and today I want to share with you a strategy we've used for years to help clients cut anywhere from 10 to 20% out of their company's health insurance budget without reducing, and in many cases, enhancing benefits for their employees. In fact, the Wall Street Journal a few weeks ago wrote an article about this, and this is specifically pertaining to pharmacy benefit managers, also known as PBMs. In this Wall Street Journal article, they talked about how Foot Locker, the Teamsters Trucking Union, and a host of other notable employers around the country were moving pharmacy benefit managers from the ones that are owned by the insurance company. So think about the insurance company that you work with today. Just picture them in your mind, particularly if you're fully insured or maybe you use them to self-fund. If you're fully insured, you're automatically using their pharmacy benefit manager. So going forward, I'm just going to reference that as a PBM. Mark Cuban has done a really good job highlighting some of the inefficiencies and outright conflicts in that market when he launched the Cost Plus Drugs program. And it's something that we've harped on for a number of years. It's a low-hanging fruit. And in fact, I think this is probably one of the bigger conflicts of interests and misaligned incentives in health insurance that causes companies like yours to pay more than you should. So to really quick, all a pharmacy benefit manager is, a PBM, is a middleman that sets the insurance price of a medication for its members. And when you think about this, as you aggregate, health insurance companies, they've got millions and millions of people that they insure. The thought is they should be able to go out and contract for better pricing using all those that leverage, that buying power, right? Just think of it's the Costco of drug buying. But what we find when we look at the data is exactly the opposite. And part of that has to do with the way health insurance companies make money. Many of them are publicly traded. You can look at their financials. The pharmacy benefit, the PBM, is one of the most profitable areas that these companies make their profit. And they do it in a couple of different ways. So I'm going to make this really simple to understand. But once you understand how the money is made, right, it's understanding the game. When you understand the rules of the game, you can then play the game the right way to get the outcome that you want, which is to win, which means lower costs for your company and your employees. So I'm just going to use this example. If you're using your health insurer's PBM, the PBM is who dictates the price of the medication when your employees go to buy it. That cost is then passed to your health insurance company. So if you're fully insured, it's calculated against your claims run, your loss ratio. If you're self-insured, that money is coming out of your company's claim fund. So whenever we talk about healthcare all the time, because whatever we spend on healthcare, those costs have to be offset by the insurance. So the more we spend on healthcare, the higher insurance costs have to go to pay for that healthcare. But so in this particular example, a member goes into the pharmacy, they buy a medication, the PBM says that medication's $50. Well, the medication doesn't really cost $50. They may only be giving a portion of that, the money that the pharmacy's collecting, that $50 is staying with the pharmacy, but a good size chunk of that is going back to the PBM, which is your health insurer. They don't disclose that to you, and they don't let you know how much it is. But we always get asked questions. Wait a minute. If I pay cash for the medication, sometimes I get a better price than my insurance company. How is that possible? Right? These insurance companies are the biggest healthcare buying organizations in America. How do they not get a better price than somebody that can walk in and just pay cash? Or maybe you have a coupon program. Why don't they let me use that coupon program, right? I'm being a good consumer. They should allow me to use this coupon, therefore they pay less. Well, that doesn't make any sense either, does it? Well, the reason why that doesn't work is because you're taking profitability from them. It's spread pricing. So pharmacy benefit managers, PBMs, they make money in two main ways. Spread pricing, so the price that they pay the pharmacy versus what the pharmacy actually charges. So use that $50 example. The pharmacy charges your employee $50 for this medication, but really only 30 of it is going to the pharmacy. That other 20 is going back to the PBM. And this is hypothetical. This is an illustration, right? But I just understand the flow of the math, directionally speaking. The other way is there's a lot of medications, particularly with brand name drugs and specialty medications, which is rebates. So a lot of these drug manufacturers, they want preferential treatment so that their medications are being filled. They'll give money to those PBMs, the insured-owned PBMs, to give them preferential treatment. So you've probably tried to fill a medication, or you've had an employee try to fill a medication and they say, I'm taking ABC drug, but it's not covered on our plan. They're making me take a different drug. A lot of those choices about what's covered and not covered, what are preferred and non-preferred, is driven by rebates. And it's a game that the manufacturers play with the PBMs, and the PBMs are looking at ways to maximize their revenue. So that's another source of revenue that they have that's contrary in many cases to your interest, which is you care about making sure your employees have access to the medications they need at the lowest possible cost so that it keeps your insurance premiums as low as possible. So the strategy that we have used is to move clients away from that big carrier. So I'm talking about Blue Cross. They partner with Prime Therapeutics. United Healthcare owns, or United Health Group owns Optum. Cigna owns the largest PBM, which is Express Scripts, ESI, and then CVS Caremark owns Aetna. So the goal here is to remove this misaligned incentive of this. In my opinion, it's a misaligned profit motive of these insurance companies. If you move away from this model to an independent pass-through PBM, and there are a number of them out there that exist, where you can strip out spread pricing. So no longer is that drug that should be $30 being charged at $50. And you can ensure that all the rebates out there from those manufacturers are coming to you and not the insurance company. But the third thing, and this is where I see this big move in the marketplace today, is patient assistance programs, manufacturers assistance programs. These are coupon programs, and international sourcing of medications. So not all three of these, your company may or may not want to use all three of these, but if you had the opportunity to remove some of the most costly medications from your health insurance program, but your employees could still access those medications, that would help lower your insurance premiums. Your employees still get the same medications. It reduces your costs. And I'll give you just a recent, a good example of how this works. If you think about these big drug manufacturers, they set up foundations to help patients pay for their medications when they can't afford them. In fact, if you watch, you'll probably notice this now, whenever you see a medication being advertised on television, we're going to be going into playoffs and Super Bowl and whatnot and bowl games, you'll see these commercials, and at the very end, it'll either be in small print or you'll hear a quiet voice come on. If you can't afford your medication, contact AstraZeneca. We may be able to help. Or contact AbbVie. We may be able to help. What they're talking about is these patient assistance programs, and they're set on income thresholds. And if you make below a certain income, they'll give you the medication at no cost. The issue is, particularly if you're with a big carrier-owned PBM, the way they design those programs, if you're insured by one of the ones I've already described, you're not eligible to get that patient assistance. Why? They won't. Number one, the PBM won't allow you to, because it's stealing revenue. They consider it, this is diverting revenue that they would otherwise get, right? These are expensive medications. That one medication fill may represent thousands of dollars of profit to those carriers. They don't want to lose it. They want to make sure that you're running it through their plan so that they can get the spread and they can get the rebates. And that right there is the conflict of interest. You may have an employee that could qualify to get their medication at no cost, but the carrier you're working with won't allow them to access it. And so I just want to share with you a recent example that we had. We picked up a client this year, and they had a member, it was a child, taking a medication that cost $750,000 per year. So this member is taking a medication that represents 30% of the total cost that this insurance company is going to spend on their employees. When we became their advisor, we moved the PBM from the carrier-owned PBM to an independent, and this member clearly qualified to get their medication for free, and that's exactly what we did. The member was able to get their same exact medication. It's delivered the exact same way they were getting it before, except now The member no longer had a copay. The member no longer had deductible or out-of-pocket expenses to cover that medication. In the old way, they were spending $5,000 a year of their out-of-pocket max to pay for the medication. In the new way, after our setup, they got their medication for free. And even just as importantly, that medication was no longer being paid by the insurance company. So what do you think is going to happen when they have a 30% reduction in their healthcare costs for that company for their renewal? They're going to get a decrease. They're going to spend less money, which is going to allow that company to offer better benefits, perhaps reduce the cost of insurance on a monthly cost basis to their employees and dependents. It's going to be a net positive for everybody involved. And so when you think about the universe of claims for your particular company, there's not a whole lot of $750,000 drugs spends out there. But inside your company, I'd be willing to bet you that you have one, maybe two. If you're just an average mid-sized employer with 100 employees, you have 1 to 2 people that are taking these really expensive medications that may qualify for that sort of program. But maybe they're high income earners and they don't qualify. Well, what else can we do? Well, a lot of these manufacturers have coupon programs where you'll be able to get the drug at a reduced cost. Your members can get the drug at a reduced cost using manufacturer dollars to help offset their own cost. So a medication that might cost $1,000, there might be a $500 coupon out there to help offset the cost of the drug. If you use that coupon, the member gets a reduced cost. Some cases they can get their medication for free, and the net cost to the insurance company is half of what it would normally be. So instead of being a $1,000 drug where a member has this big copay, it'd be half the cost to the insurance company. So those things add up over time and can generate large savings. And then the third concept, and this one can be a little bit more controversial, but we have a number of clients that are using this, and we've been doing this for years, and that's international sourcing of medication. You've probably heard some in the news about being able to buy medications in Canada or New Zealand or different parts of Europe. The reason that is the drug prices are the highest here in the United States of America. We allow the drug companies to advertise to our people. We allow them, the way our insurance system is set up, to charge us more, and they don't get away with that in other parts of the world. And so that creates this arbitrage opportunity where we've seen medications that might cost $150,000 in the States. And I'm thinking of a Stelara to give you a perfect example. I see that drug more and more frequently now. And it's used to treat inflammatory diseases like Crohn's. And a course of treatment for a year for one person might be $140,000 to $200,000 per year. And you can get that drug for about 75% less, 50 to 75% less. Well, we've just sourced it recently for 75% less in another country than you can buy it in the United States. There's a number of considerations that we want to make. The most notable thing is it's the exact same medication. So there's only one maker of that medication. It's the same box, same manufacturer, delivered in the same way. So that medication is delivered by mail order. It's drop shipped to a member's house. It works the same way. So your member's getting the exact same medication. It's no cost to them. It's an opt-in program, so they don't have to do it if they don't want, but it's another tool in your arsenal to help reduce the cost of claims, which reduces the cost of insurance. So, wrapping this all up with a bow, why did Foot Locker, the Teamsters Trucking Union, and a host of other large employers across the country decide to ditch their PBMs? It's because they realized the insurance-owned PBMs weren't working in their best interests, and they could get the exact same medications for their employees at a fraction of the cost. And when you properly address the cost of healthcare, you can lower the cost of health insurance. This is an easy way, easy low-hanging fruit to be able to add more profitability to your bottom line, add more money into your employee's paycheck, and to create sustainability in your company's benefit program. If you have questions about how to do this for your company, feel free to send me a note. You can schedule a time. I'm happy to share with you more detailed process and strategy of how to adopt this and what it might actually mean for your specific company. But until then, take care.